This is Nationwide on the NTA, reaching you live from Abuja. Thanks for joining us. I'm Hawa Salihu Adama. We start with the latest from the NCDC on COVID-19. The Nigeria Center for Disease Control has announced 195 new cases of COVID-19 in the country, bringing the number of confirmed cases to 3,145. Of the 195 new cases, 82 are in Lagos, 30 in Kano, 19 in Zamfara, 18 in Sokoto, 10 in Borno, 9 in the Federal Capital Territory, 8 in Oyo, 5 in Kebbi and Gombe states, while 4 are in Ogun, with 3 in Katsina State. Kaduna and Adamawa have 1 case each. 534 have been discharged so far, with 103 deaths recorded. Just reaching us is a report that says vehicular movement along the old KARU road linking Nyanya into Abuja has been restricted by security operatives. Our own Usman Aliyu is caught up in that chaos. Let's now join Usman for a situation report. Usman, if you can hear me, we can see pictures at your location. How long have you been at your current location, and what's the explanation for the chaos there?
I am now along Old KARU Road. That is the bypass road linking Abuja, FTC, and Nasarawa. And it is a link, as I said, between FTC and Nasarawa State. For quite some time, since I think more than 3 hours, movement has been restricted along that path. The tourist places are saying that people are disobeying the guidelines issued by the presidential task force by moving freely from the FTC to Nasarawa. This is what the security operatives told me right now. They say that the Nasarawa state government complained to the federal capital administration that people are just moving freely, and because of that, there have been issues and orders to stop anybody, no matter who is he, no essential worker, no anybody to go inside the FTC or come to the Nasarawa state axis. And that place is very strategic to the people living around that area, because there are 2 major markets identified in that area. The markets are the Abuja, which is in Nasarawa state, and there is KARU market, which is in the FTC. People are very restricted to go anywhere from that axis. But I can see that people are moving barefoot and leaving the commercial motorcycles either the FTC or the Nasarawa. So this is the situation for now.
Okay, Usman, I'm just wondering, for people like you that are essential workers, have you tried to approach these guys to explain your situation and the fact that you need to be at work?
Yes, I told them, this place is basically it is housing a lot of essential workers. There are a lot of journalists and medical workers, usually the security operatives themselves, living in that particular area. When I approached the security people there, they told me that the order they have been given that they will not allow anybody to go to cross. I showed them my ID card, but they said that there is nothing they can do as of now, because the security operatives are being asked to stop anybody from going going either to the federal capital or to the national hospital.
Okay, Usman, thank you very much for the update. That will be all for now. I guess the relevant authorities are with us on this matter. In the meantime, while the 8 p.m. to 8 a.m. curfew remains in states like 8 p.m. to 8 a.m. curfew remains in states like Lagos, Ogun, and the Federal Capital Territory, some groups of essential service providers seem to be having a hard time with making their way past military checkpoints, enforcing the curfew. Major General John Enenche, coordinator, the Directorate of Defense Media Operations, joined us earlier today to shed some light on the matter. He spoke with Najatu Tijani. Unfortunately, we cannot take that report now as we have to join the PTF for the daily briefing for today.
The DGN CDC, the national coordinator.
And thanks for rejoining us on Nationwide. We are live in Abuja. Now, President Muhammadu Buhari and the Prime Minister of the Islamic Republic of Pakistan, His Excellency Mr. Imran Khan, this Thursday afternoon had a telephone conversation on the global initiative on debt relief canvassed by leaders of the non-aligned movement during an online summit held on Monday. A statement by the special advisor to the president on media and publicity notes that leaders of the 120-nation organization, the largest after the United Nations, had agreed that a debt relief campaign be launched for developing countries to deal with the COVID-19 coronavirus pandemic and unprecedented health and social economic challenges facing most of them. And we now rejoin Mitaire Ikben on standby to give us details of the highlights of the just concluded briefing by the Presidential Task Force on COVID-19. Mitaire.
Thank you very much. The Presidential Task Force and its members today expressed surprise that journalists are still harassed, are still mistreated, are still denied access to move to and from work during curfew hours. It says this is contrary to the directives, the instructions, and the entreaties it has made severally to the security agencies that journalists are essential workers and they are exempted from the curfew because of the role that they perform in information dissemination, especially at this time that the nation is managing a pandemic. And when I posed the question today and I raised the issue with the Presidential Task Force, the National Coordinator, Dr. Sani Aliyu, said ahead of meeting with the security agencies tomorrow, he will place a call to the security chiefs to ensure that they talk to their operatives ahead of that meeting tomorrow to stop immediately, to stop forthwith the harassment and the mistreatment of journalists and the denial of access of movements to journalists during the curfew hours. And it is expected that this will bring some respite to the nasty experiences that some of our colleagues have been having even up till yesterday, when some of them were made to turn back by soldiers and return to the office to sleep in the office. We hope that this will definitely come to an end, and not just only for our colleagues, but other media practitioners. And also today, the Presidential Task Force said it has continued to notice breaches of its guidelines across the country, especially the guidelines on social distancing, the guidelines on use of the face mask, and the ban on interstate travel. In fact, the Presidential Task Force chairman, Mr. Boss Mustafa, said the PTF has received reports of compromise of security operatives, especially with regard to the ban on interstate movement. And it said it has instructed the heads of the security agencies to ensure that this compromise is checkmated in order not to defeat the overall purpose of managing and containing the spread of the coronavirus pandemic. And this is also hoping that with the call, the National Coordinator said will be placed to the heads of security agencies today. It is hoped that this will bring about a better relationship between the military and media practitioners, especially as they work together in contributing their quota to the fight against the coronavirus in this country.
Terry, I was just going to ask, because we had a situation with one of our correspondents. Although the minister tried to address this yesterday, I was wondering, what do we expect anything positive after today as far as harassment of essential workers is concerned?
Precisely, that was what I said earlier. The PTF said the calls will be placed to the heads of the security agencies today, definitely, as this briefing is ending, and it is expected that the harassment and mistreatment will not continue, because the heads of the security agencies are expected to make calls and also give the right operating order to their operatives who are on the field, so that our colleagues do not continue to have nasty experiences.
Okay. Thank you, Mitari, for that. And earlier on, we had an interview with the Major General John Enenche, Coordinator, the Directorate of Defense Media Operation, where he tried to explain more on the issue of harassment of essential workers.
Is it possible that your personnel have not been adequately briefed on the people who have been exempted from the 8 p.m. to 6 a.m. curfew? I'm asking because we have reports of personnel preventing reporters from getting home after the close of work, because sometimes we close as late as 11 p.m., but some of them are not being allowed to go home.
We were adequately briefed, and the men out there were adequately briefed. The problem is that we have a lot of curfew breakers, people who are not keeping to the guidelines provided for reasons best known to them. So you come to the checkpoints, you see that the queues are so long, and then people are just there who are breaking the curfew. Then secondly, for the first leg of this lockdown that we had for the first 4 weeks, there were a lot of people who forged identities. The identifications that they gave them, both for the journalists, for the medics, for the essential staff, they were forged. So this time around, we needed to take more proactive steps to ensure that people that identify themselves are properly done. But the major problem there was the people that disobeyed, and we had long queues, to be able to sort them out one after the other before they could pass. Otherwise, we were adequately briefed, and they were briefed about the non-essentials.
Now, these are difficult times, no doubt, with a very difficult situation for both parties. Yeah. So what else is the military doing to ensure that personnel handle this situation with a human face? Yes,
in short, I would tell you that we got the report up to early hours of this morning. I was virtually awake throughout the night, from around 9 p.m. when the crowds, the traffic started mounting. And I got reports of even people from media houses that closed late, not being allowed to pass. And when we tried to say where are they were far behind the queue, medical staff and all. So we now came up with a meeting today, which as I speak with you is on, so that we can now find alternatives to how we sort them out. But more importantly, I will appeal to the general public to know that when there is a curfew, it's a total stoppage of movement. It's nothing like you can move between the hours of 8 p.m. and then the 6 a.m.
Let's talk about the rules of engagement in all this. Have the terms changed?
They have not changed at all. It is minimum necessary effort to ensure that the people conform to the guidelines.
On the flip side, what happens to any erring personnel caught being hostile or overzealous?
Any personnel caught being hostile, overzealous, reported, and we find the person must be sanctioned.
My colleague Najatu Tijani there, speaking with the coordinator Defense Media Operation on the curfew and essential workers. We now join Ruth in our Lagos Network Center for top stories from that zone. Hello, Ruth. You're on.
Thank you, Hawa. The first batch of Nigerians stranded abroad due to global lockdown caused by coronavirus pandemic have arrived the country from the United Arab Emirates. The 256 returnees were received by officials of the Nigeria Center for Disease Control at the international wing of the Murtala Mohammed Airport, Lagos. Abolade Salami reports.
National operations, the returnees were subjected to compulsory checks by port health workers, the immigration and security agents. In spite of certifying their health status, the country is not taking chances. Arrangements have been made for compulsory self-isolation for a period of 14 days.
In line with the existing protocol, before anybody could be allowed to come to the country, they had all to be tested. And information we had that they are all tested negative. So that's why they have been taken to the isolation center for the existing protocol that we have in the country.
Although journalists were not granted access to the returnees, but the look from their faces depicts joy, hope and satisfaction of returning to their motherland. Officials from the Nigerian Diaspora Commission said their documents and health reports were processed before departing United Arab Emirates, but that will not stop them from complying with the Presidential Task Force directive on isolation.
It's what the NCDC requires, it's what the Presidential Task Force on the COVID-19 is part of the requirement, it's part of the Lagos State requirement. So assuring extra layer of safety is not far-fetched.
More Nigerians who have signaled their intention to return to the country due to the coronavirus will be arriving from the United Kingdom and United States of America in the coming days. In Lagos, Abolade Salami, NTA News.
Government and key players in the health sector all over the world are relentless in finding a permanent solution to the novel coronavirus pandemic. In this report, Hengino John Adams takes a look at initiatives being taken by the Flying Doctors of Nigeria to make testing safer and further enhance the protection of health workers during this pandemic.
Health workers are not spared from COVID-19 as some of them are being infected on the line of duty, sometimes even with the personal protective equipment. Limiting the level of exposure of health workers as they take samples for coronavirus tests has been a source of concern globally. Localizing solutions to COVID-19 in Nigeria is what birthed this initiative, a COVID-19 testing vehicle with a barrier between the patient and the health worker.
It's cheaper because instead of changing PPE between patients and using 10, 20 PPEs in the day, which cost 50,000 naira each, you're now just using one and you're using less. You don't have to use the full thing. You can contact Flying Doctors. Our number is on our website. You can email Flying Doctors as well, and we'll provide it. But we don't just provide the vehicle. We provide the vehicle with the hand washing station, with the disinfectant, with the PPE, and with the test kits. So immediately you have the vehicle, you have an entire testing kit. We also have a training package.
The initiative also takes testing closer to the people as the nation battles community transmission.
Confer so many advantages because now that we have gone to the level of community testing, sometimes you see med lab scientists collecting samples outside, sometimes in the sun. The vehicle provides a shade, a kind of a shade from that, and then it shields the med lab scientists collecting the sample from any potential, source of infection.
COVID-19 testing vehicle and COVID-19 testing booth are initiatives which will help in combating coronavirus. It is expected that this will awaken the creativity of more Nigerians in the fight against diseases. In Lagos, Hengino John Adams, NTA News.
That's it from this end. Nationwide continues with Hawa in Abuja after this break.
I wish to once again commend the frontline workers across the country who, on a daily basis, risk everything to ensure we win this fight. For those who got infected in the line of duty, rest assured that government will do all it takes to support you and your families during this exceedingly difficult period. I will also take this opportunity to assure you all that your safety, well-being, and welfare remains paramount to our government. I am using this opportunity to express our deepest condolences to the families of all Nigerians that have lost their loved ones as a result of the COVID-19 pandemic. This is our collective loss, and we share your grief.
There is a lot of fake news and report circulating, especially on social media, on the coronavirus. Do not believe or partake in the spread of these fake reports. If it is not on the official website or news from the Nigerian Center for Disease Control, NCDC, disregard such report. Only together can we beat this virus. Only together can we overcome this pandemic. Follow the instructions and guidelines provided to combat this virus. Most importantly, stay at home. Self-isolate, regardless of your status. The virus doesn't move unless we move. Let us work together to better Nigeria. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
This is to say a big thank you to all the healthcare workers who put their lives on the line, working in all the 36 states of the Federal Republic of Nigeria, especially Lagos, Kano, Ogun, and Abuja, to ensure that we beat COVID-19 in the least possible time. Thank you so much. You are our superheroes. This message is from the Governor's Wives Forum, the wife of the Vice President and the First Lady of the Federal Republic of Nigeria.
Welcome, dear. Have you washed your hands?
Inside my house again. This thing not the key black man.
I don't know if it's misinformation or poor hygiene that will kill you first. Coronavirus is real, and good hygiene practice will save your life. Anyway, no hand washing, no eating.
I will not take care of it. I was one of the parents. Coronavirus is real and it's on the rise. But you can help yourself and help others to be safe. Remember, we can stop the spread. It's in your hands.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
Thanks for rejoining us on Nationwide. The Anambra State Governor, Willie Obiano, says his administration is committed to delivering quality health care in the rural communities. Governor Obiano stated this when he inspected a 100-bed hospital facility at Umeri General Hospital, equipped by one of the financial institutions in the state. Uchenna Ngukwe reports.
Umeri General Hospital is one of the oldest hospitals in Anambra East local government area. The hospital is one of the such centers equipped with 20 beds by the state government to receive would-be patients of the novel coronavirus disease. Governor Obiano is, however, delighted that the financial institution operational in the state has equipped the hospital with an additional 100 beds as part of his contribution in the fight against coronavirus pandemic.
So this hospital has now 120 beds. We'll ensure we increase the number of doctors and the nurses, so that when people come here, they will come to a beautiful hospital.
The Chief of Staff to the State, Primus Odley, and the State Commissioner for Health, Dr. Vincent Okpala, had earlier inspected the functionality of the equipment in another isolation center at the Immaculate Heart Multi-Specialty Hospital, Aguleri, also in Anambra East local government area.
This facility has all those devices that will help a patient to support or improve their oxygenation and support respiration. So for very mild patients, if they come here, they have the facility to take care of them.
Since the outbreak of coronavirus in the country, Anambra State has recorded only one case who has been treated and discharged. Okoyo, NTA News.
And with rapid changes in events and happenings across the country are now constantly driving the public to seek sources for information to keep abreast of major developments, driving headlines across all platforms. With many unconfirmed and unverified accounts of happenings in the public domain, NTA now links up with our reporters in the field to establish the authenticity of some of these claims. We join Mustafa Yusuf Musa in Damaturu, Rofia Anima Shao Badmos in Ibadan, Fatima Sanusi Karaye in Kanu, and Emmanuel Akila in Gombe. Good afternoon to you all. I'm going to be starting with Mustafa in Damaturu. What do we have on the investigation into the cause of the reported death in YOBE State? We hear Potiskum is the hardest hit. What is the government's position on this?
Yeah, in the last couple of weeks, there was this reported cases of death in 3 local government areas of YOBE State, particularly in Potiskum, Nguru, and Gashua. So yesterday we went to Potiskum town. It's a cosmopolitan town in YOBE State. A lot of people, and we went to the graveyard. We went to the town. We met with the Director of Personnel Management of the local government, and we inquired about the situation. He told us that in the 5 graveyards in the town, last from 30th April to 3rd of May, they reported about 150 deaths, though not connected with COVID-19. And in Gashua and Guru is the same story. A lot of deaths, but not connected with COVID-19. Even yesterday, the Commissioner of Information released a statement, and the spokesman of the governor released a statement. And just a while ago, the Commissioner of Health, Dr. Mohamed Lawangana, had a press conference with journalists while he briefed them about the situation. He said they are about the situation. They have sent an investigative team to look into the causes of the deaths around those areas.
Okay, Mustafa, while investigation is ongoing, what is the position of the government at this time?
Yeah, the government has constituted a committee to immediately look at the remote causes of such deaths, so that at least they will intervene. But they have sent their team to those areas to go and find out.
Okay, I'm going to put you on pause now and go to Fatima in Kanu. Fatima, Kanu is still in complete lockdown, but then people are having to take their sick to the hospital nonetheless, and not necessarily because of COVID-19. What do you have on claims that doctors in Kanu are shying away from hospital, attending to outpatients over the fear of COVID-19?
Well, hello, Hawa. Nice to see you. What is happening in Kanu is that doctors are not absconded from their duty post. I spoke with Professor Issa Abubakar of Center for Infectious Diseases at Amina Kanu Teaching Hospital a while ago, and he told me that most hospitals in Kanu, some workers have contracted this novel coronavirus, and they cannot come to work. They have to isolate themselves to protect their patients. In some hospitals, even those issuing cards have this virus. So it is making it difficult for both health workers and patients. The public relation officer of Malam Amina Kanu Teaching Hospital also told me that the situation is affecting, it's only affecting it's not affecting pediatric doctors, family medicine doctors, and so on. So when doctors
how do they intend to fill this gap, Fatima? How do they intend to fill this gap?
So what is happening is that hospital, at a teaching hospital, they give phone numbers for some doctors for specialty clinics, so that when a patient is in need of seeing a doctor, they will call that number. For example, they gave a number for child and adolescent clinic, adult psychiatry, child health, orthopedic clinic, and pediatric clinic. So that is what is happening in Kano.
Okay, that will be all for now, Fatima, while I join Rufia in Ibadan. Rufia, can you confirm if indeed some suspected COVID-19 cases are refusing to be taken to the isolation center in Ibadan?
Good evening, yeah, the news about the so-confirmed COVID-19 patients are absconded from the isolation center here in Ibadan is not true. There were actually some people that were tested, and before the results came out, 2 out of these people disappeared. They were not able to get to isolation. And of course, after intensive contact tracing, one of them has been found and admitted to the infectious disease control.
Okay, Rufia. I will just join Emmanuel.
Is clear for the vehicle. Presently, we have 52 confirmed cases of COVID-19 in Oyo State. 16 are active recovered cases, while 34 are active cases. As we speak, so the isolation center in Ododo is up and running. There are 18 patients there, and there are also plans of establishing isolation center.
Rufia, thank you very much for the update there, but I'm just going to join Emmanuel Akila now in Gombe. Emmanuel, what is the latest on the treatment of COVID-19 patients in Gombe? How have things changed since the return to the treatment center? That's after the protest.
Hello?
Emmanuel, if you can hear me, I just asked what the latest is on the treatment of COVID-19 patients in Gombe after the return to the treatment center. That's after the protest.
Thank you very much, Hawa, and thank you for joining us in Gombe. Actually, what happened yesterday in Gombe State, particularly in the metropolis, has been described as absurd and as an absurd situation by a lot of people, because patients who are supposed to be in isolation came out for testing on some issues that they regard as welfare, and as at the moment, the task force committee on COVID-19 in the state has rallied round support and ensured that all of them that came out for protest yesterday in some of the centers have been returned to the isolation centers. And during the state task force briefing today, the task force committee assured that they have contained the situation, and all the patients that have been returned are being taken care of, and some of the demands that they raised during the protest have been attended to. And one important thing that you need to know, Hawa, is that though Gombe State has a sharp rise in the number of confirmed cases, which is standing at 103 at the moment, but the good news is that since the confirmation of the 5 index cases in April 21st, none of the confirmed cases is showing symptoms of COVID-19. So during the briefing yesterday, the State Task Force on COVID-19 said some of them have been tested, and they will continue to be tested and tested, so that when they are found negative, finally be discharged. Meanwhile, the state government has set up isolation centers, over 300 bed spaces, and a treatment center with ventilators.
Emmanuel, thank you very much. Emmanuel, thank you very much for the update. We are glad that things are getting back to normal in Gombe. And guys, thank you very much for joining us on Nationwide today. We truly appreciate your contributions.
You're welcome, Hawa.
Moving on, supermarkets, pharmacies and markets are among the public places which are exempted from closure during the COVID-19 lockdown. Olabode Arewa in this report examines the level of compliance with the health and social distancing measures outlined by the National Center for Disease Control.
In the wake of the federal government's gradual relaxation of the lockdown imposed on Lagos, Ogun and Abuja, residents of these areas have resumed their usual hustle and bustle. These young shoppers are just emerging from a supermarket at Wuse in the heart of the Federal Capital Territory. Just like many Nigerians, restrictions occasioned by the coronavirus pandemic have not dampened their love for shopping.
Like before you go inside, if you don't have a face mask, they'll tell you to get one at the entrance. Then you sanitize your hands before you go inside.
The safety measure and the precaution they are taking is better than before.
They are following all the instructions by NCDC. And there is no long queues also here as usual like last week and early this week.
Their observations on the level of compliance with the health guidelines on COVID-19 was confirmed at some supermarkets visited by our news crew, where the customers were made to wash their hands before entry. This supermarket in the heart of Abuja has gone further to provide a billboard informing customers of the need to put on face masks and to wash their hands before they go into the supermarket.
That's a national policy that every customer coming into any supermarket must wear a mask, wash his hands, and of course use the hand sanitizer.
Yes, we have situations like that where customers will come and we want to give them a hand sanitizer. Maybe for instance they're not wearing, putting on face masks, and the security at the gate will tell them to put on face masks. They will angrily leave. That they have their face masks at home and stuff like that. They will angrily leave.
The Presidential Task Force on COVID-19 has consistently advised Nigerians to avoid crowding in public places and use the face mask, having identified community transmission as one of the reasons for the increase in COVID-19 infections. In Abuja, Olabode Arewa, NTA News.
And long queues were seen in banks across the country immediately after the lockdown put in place to curb the coronavirus pandemic was relaxed. Days after, what's the situation? Let's now join Muplang Dakok, who visited some banks in Abuja.
We're in front of one of the banks in Central area this Thursday, and we observed that the social distancing rule is being obeyed. People have to wear their masks before allowed entry into the banks. We also noticed that the staff of the bank are trying as much as possible to control the crowds.
I enjoy the service, the way they are attending to people, so that it will decongest the population in the bank.
The social distance is the first thing, and people are not allowed to go in front of a crowd like we used to do before.
In another bank, we found people being made to sit around and stand outside to avoid congesting the banking hall.
It's like a lot of people were just waiting for the lockdown to be released so that they can come do their pending transactions. So actually I've been here since 7 a.m. and unfortunately the network has been so down, so I've not been able to achieve what I came for.
When I came in, I washed my hands, I was given a number, and I went to do my transaction successfully. Well, I had no problem at all. It was well conducted. Yes.
Since there are so many customers to attend to within the 8 a.m. to 2 p.m. permitted time for banking operations, many banks have sent emails to customers encouraging them to still use online channels and ATM machines for their transactions. In Abuja, Muplang Dakok, NTA News.
And Zulay in our Kaduna Network Center is next in line with more reports. Hello, Zulay.
Well, good evening and welcome to Kaduna. As the country continues to grapple its way out of the coronavirus pandemic, concerns are high that the elderly and those with health complications are at risk of being neglected by health facilities on account of their vulnerability to the virus. Achari Maxwell in this report takes a look at the elderly in the hospital amidst the novel coronavirus.
Bako is at the Barao Diko Teaching Hospital's Kaduna with an unconscious 73-year-old mother who is just one out of the many 8 patients currently being attended to at this facility. This reality contrasts with the speculations that the elderly are most often denied access to medical attention due to their vulnerability to the coronavirus.
My mother is 73, but they're attending to her.
Professor Abdulkadir Musa Tabari, the Chief Medical Director of the hospital, confirms that the hospital receives patients regardless of their age, and with adequate measures put in place to prevent them from exposure to the virus. Where applicable, he says, consultations are done through the GSM to save the patients from coming to the hospitals.
For instance, any particular mode of treatment, we can call and we can ask you to continue, or we describe to you what you should do and continue at home, for instance. Also, we have some other patients also that are taking medications. If you can call and tell us that your drugs has finished and you're supposed to come back to the hospital so date. So we ask you whether you have additional symptoms. If you have additional symptoms, the doctor will tell you what to do next, whether to continue their drugs or to change your drugs.
Those that are not critically ill, we ask them to wait outside. We receive the emergency cases, and thereafter we tell the other one that are not critically ill, we bring them inside. So when we don't allow them to come en masse, they feel we don't want to attend to them, and that's why they say we are sending them away.
Barao Dikko Teaching Hospital is one of the major healthcare facilities in Kaduna State. Achari Maxwell, NTA News.
And Kaduna State Command of the Nigerian Security and Civil Defense Corps says it has impounded more than 20 vehicles of drivers who violate the ban on interstate travel. The State Commandant of the Corps, Babangida Abdullahi Dutima, stated this while monitoring the level of compliance. Ahmed Umar Kudan reports.
The ban on interstate travel is meant to curb the spread of coronavirus, as most of the people who tested positive for the virus in Kaduna State have travel history. In spite of the ban on interstate travel, movement of food items and other essential goods is allowed. Operatives of the Nigerian Security and Civil Defense Corps and other security agencies are at different locations to prevent the influx of passengers into Kaduna, with the State Commandant of the Corps, Babangida Abdullahi Dusama, monitoring enforcement at the entry and exit points. He says the command has apprehended many defaulters and handed them over for prosecution in the COVID-19 mobile courts.
Those that intend to break the law, we cannot just allow them to go free. Some of the vehicles that we found are not very necessary, or they are not carrying essential facilities. We impounded them and we make sure that the owners are prosecuted, and the drivers are prosecuted.
The command has also advised travelers to avoid Kaduna State, as security operatives will not relent in enforcing the interstate travel ban in the fight against COVID-19. In Kaduna, Ahmed Umar Kudan, NTA News.
And we're back to Hawa in Abuja for more on Nationwide.
Very well, Zule. And back here in Abuja, the United Nations Women has donated over 38 million naira to the Federal Ministry of Women Affairs as support to Nigerian women who are worst hit by the effects of the lockdown. Momso Damien Dati captured the presentation at the Women Affairs Ministry.
The Ministry of Women Affairs is opening its gates after the long compulsory lockdown break. Activities are gradually picking up, and the first callers to the ministry are the United Nations women.
No longer in the shadow, cause to stay behind.
Open gates later led to wide smiles, as they did not come empty-handed, but with some monetary support for Nigerian women who was hit by the effects of the lockdown.
Frontline services in Lagos, for example, have reported a 300% increase in gender-based violence cases from March to April. So in view of some of these challenges being faced by women, UN Women is very happy to be collaborating with the Ministry of Women's Affairs as part of its humanitarian response. Hope that the support will meet the immediate needs of up to 12,600 vulnerable women and girls by improving their food security and their access to hygiene.
The Minister of Women Affairs, Paul Ntalan, is appreciative of the gesture, promising equitable distribution among women across the 36 states.
We continue to appreciate and work together to see that Nigerian women are well cared for. These palliatives and whatever we're reaching out to, the poorest of the poor, those who live on daily business to earn their living.
38,453,7 660 naira is the support received. In Abuja, Momso Damien Ati, NTA News.
The can-do spirit in ensuring self-protection is given priority in the fight against the novel coronavirus pandemic. It's been re-emphasized by the leadership of the Radio, Television, Theatre and Arts Workers Union, RATAU. This follows distribution of safety palliatives to media workers in the FCT to promote personal hygiene and observe regulatory guidelines. Abubakar Usman Akwanga completes the report.
The continued involvement of the media as one of the frontline agencies in the fight against coronavirus pandemic is the reason for the distribution of these protective kits. The growing waves and increasing impact of coronavirus pandemic to human lives, especially frontline workers, has remained on the front burner of stakeholders in the media industry. Worried by the situation, RATAU is taking the bull by the horn to mitigate chances of its members being exposed to contracting COVID-19 in a bid to accurately inform the public on update of the pandemic.
As politicians and policymakers find ways of mitigating this threatening epidemic, media practitioners, among whom are members of our union, deserve special commendation for the reportage of COVID-19 despite the hazards associated with it.
And we have to monitor it to make sure that this thing gets down to our members. And you as the chairman, you have to be giving us reports every week. Comrade
Afo James is a staff with the Nigerian Press Council and says she observes safety measures from home to workplace and appreciates the intervention by RATAU.
I'll make sure that it's on me. I'll wear it, then in some few minutes I'll go and wash my hands when I touch them, because what some people don't know is that we are using toilets in the office. Some people will come and they'll use hand to open the door and to close it. The moment you go, you come back, you wash your hands.
The union is also making case for more support that will motivate its members to stay alive and carry out daunting national assignment. The measures is in tune with the efforts of RATAU in safeguarding the lives of its members while in line of duty. In Abuja, Abubakar Usman Akwanga, NTA News.
Agatha, in our Benin Network Center, will now guide us on top stories from that axis.
Hawa, a warm welcome to Benin. 107 travelers flouting the federal government's restriction on interstate movement have been intercepted in various parts of Edo State by security agents enforcing the lockdown of interstate boundaries. The report. Of the 107 travelers, 26 en route Zaria from Rivers State, being ferried in a truck laden with salt, were intercepted on Saple Road in Benin City. They were interrogated by Governor Godwin Obaseki at the Stella Obasanjo Hospital Isolation Center.
We are going to do testing for all of them. After this is done, we will have all their records.
81 others moving from Kano State were intercepted at night in Esa Central Local Government Area. They were screened at the Irwa Specialist Teaching Hospital.
Those who are due for PCR testing will then be tested. Once we get the results, of course, the NCDC will be informed, the state government will be informed.
Mostly children and women were inside the truck. You can see we are trying to profile them.
Some of the migrants explained why they embarked on the journey.
Normally, we go drive. Not that place where I did. Therefore, I'll go Lagos.
The reason that we came out from our hometown because of the life we are. That is why. And most of us doesn't have money.
The travelers have been sent back. The Oba of Benin, Ewaye II, has donated palliatives to the Edo State Council of the Nigerian Union of Journalists. It is to help cushion the effects of the coronavirus pandemic. Ifama Okafo reports.
Just like other essential workers at the front line in the fight against COVID-19, journalists are also exposed to various hazards. Therefore, the palliative from the Oba, which he sent through the Oba Ewaye Foundation to journalists at the NUJ Secretariat, were received with great joy.
Because we have been endowed to do our work, which we have been called upon to do,
Oba remembered us.
Delivering the welfare packages, the Obasogie of Benin Kingdom, Edu Ehato, and other members of the entourage described Oba as the father of all, who recognizes the unique role journalists play in every society.
He fed charity begins at home. He has started with the NUJ to give them this palliative measure of cushioning what is going on. He is going to do more to all the local government area, but before then he said we should start from here.
For him to remember the journalists at this particular time in the world, we sincerely appreciate him.
Some of the items donated include noodles, bags of rice, face masks, and hand sanitizers. In Benin, Ifoma Okafor, NTA News.
That ends our package. Nationwide continues after this break. To stay.
The number of the COVID-19 cases in Nigeria is increasing daily, with many more tests ongoing. The battle of testing, isolating, treating, and attending to the affected persons rests heavily on the shoulders of our health workers, constantly putting their lives on the line and at risk to contain this virus, save and protect the lives of millions of Nigerians. To these health workers, we at the Nigerian Television Authority, NTA, on behalf of millions of Nigerians, say a big thank you for all that you have done and are doing. To the security agencies enforcing the lockdown and every other frontliner, we say thank you for putting your lives on the line to save ours. There is no amount of words that can quantify our gratitude. Thank you. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Staying at home is the most responsible thing to do. Please, learn a new skill. Be a better version of yourself. That's what I spend my time doing. Prevention, they say, is better than cure. I beg, make we sit down for house. I know some of us want to get back to socializing, but if we don't sit down for us, no good feel happen. Please, stay safe and stay responsible.
The following guidelines for eased lockdown, as announced by the Presidential Task Force on COVID-19, are effective from 4th May 2020 in Abuja, Lagos, and Ogun states. For public spaces, the following are mandatory: improvised face masks, temperature checks, hand washing facilities and hand sanitizers, physical distance of at least 2 meters, no sporting activities and mass gathering. On travel, these are prohibited: passenger flights, interstate travel except essential services, movement of agro products and petroleum products. Note, there will be mandatory supervised isolation of returnees for at least 14 days. For markets and offices, neighborhood markets are to open 3 times a week from the hours of 8 a.m. to 3 p.m. Banks and financial services are to open from 8 a.m. to 2 p.m. Government offices are open only to staff from grade level 14 to 17 between the hours of 8 a.m. and 2 p.m. daily. Corporate offices and private sector are open to business from 8 a.m. to 2 p.m. Schools, churches, mosques, clubs, bars and gardens remain closed till further notice. COVID-19 is real. Take responsibility and stay safe.
Wetin be this coronavirus thing? Na true?
You see this coronavirus wey be COVID-19, na the whole world palava, and e don dey kill many people for China, Italy, UK, US, Spain, and even for other countries dem.
Okay, wetin come be the reason wey dem say make everybody tanda for house?
Na because if e dey waka pium go carry am from person wey don get am, you go carry come give your family dem. Na so the thing take dey kill other people for other countries.
Okay, wetin come be that social distancing sef?
You see social distance. Now make we no come close, because this thing now from air and touch now with the contact. We supposed dey at least 6 foot away from each other every time.
So okay, no be only to wash your hand and to sanitize them alone.
Make we no take this motion of hand thing take play, but make we come together, join hand as we take pursue Ebola, pursue this coronavirus. They could be each other and keep us.
It's still nationwide. It's the fourth day since the federal government relaxed the lockdown in the Federal Capital Territory, Lagos and Ogun states, and all sectors of the economy are gradually picking up. What is the situation in the FCT? Kunle Adeye takes the story from here.
This is one of the financial institutions at Area 3 in the Federal Capital Territory. The reason for the crowd can be understood. After 5 weeks of lockdown, customers must have issues that need to be resolved, but this is a total contrast to safety precautions given by the federal government for easing the lockdown, a situation bank customers described as unfortunate.
What I'm seeing is to me is an eyesore, It's actually defeating the aim which the government has said social distancing should be met. But with what I'm seeing, to be honest with you, this is not good.
It was a different scenario at another commercial bank at Area 8.
I must commend bank for complying with the federal government directives. Operation India has been wonderful. People actually complying to social distance. And I think if other banks can emulate, I think it's worthy of emulation.
Wuse and Utako markets were not open for commercial activities since the day does not fall among those scheduled for market operations. But the Wuse bus stop is another flashpoint that came alive on Thursday.
But we are maintaining the social distancing. You can still look at my vehicle. It's just one at the front and two at the back. And you must fix your nose mask. If not, we will not allow you to enter.
Time will tell if the ease on restriction will continue, since the level of compliance with the federal government guidelines would be assessed soon before further pronouncements. In Abuja, Kunle Adeye, NTA News.
As schools remain shut, occasioned by the coronavirus pandemic, educational online programs for students and pupils have been ongoing in Calabar, Cross River State. With impressive feedbacks from some students and parents, accessibility to network and insufficient funds to acquire data for telecommunication purposes are, however, viewed as some major challenges associated with the program. Maureen Leo Ajom reports.
Technology is the ability to make use of what we've learned in science.
I talk on things to respect.
That is the soundtrack from the School on Radio for students and pupils, as well as parents who are being told to encourage their wards to be positively engaged during the period of lockdown. As part of sacrifices during the pandemic, this private media outfit, in collaboration with the state government, put together the School on Radio program, which runs daily on core subjects like mathematics, English studies, basic science, and civic education.
With regards to this, we rose up and began this program long before even the federal government came up with theirs.
They're giving homework every day on the show, and if you get it right, there's this prize for you. So the children are responding.
Some private schools in the state are also engaging their pupils and students on online learning, and the feedback explains its acceptability.
We just have to put our heads together to make it work for the kids.
It has also helped to take the child away from the cartoon and other activities he has always been involved in.
Why those of our people, our children in the city are benefiting, I'm still wondering how our children in the hinterland are going to cope with it.
Findings reveal that factors such as non-availability of network and proper supply negate the effectiveness of the program. In Calabar, Maureen Leo Ajom, NTA News.
And from Calabar to Kanu, where two warehouses stocked with several tons of food items have been sealed in Kanu by the State Public Complaints and Anti-Corruption Commission for allegedly hoarding the commodities. Yahanasu Hassan Barau completes the report.
Beyond the tragic health hazard of COVID-19, the economic uncertainty and disruptions that have resulted come at a significant cost to the economy. More worrisome is the alleged hoarding of food items by some traders in Kanu, who then resell at exorbitant prices, taking advantage of the lockdown order, thereby causing an untold hardship on the vulnerable. This necessitated the prompt intervention of the State Public Complaints and Anti-Corruption Commission to embark on an inspection tour of some warehouses within the metropolis, and the result paid off.
These are thousands of bags of wheat flour and cartons of pasta foods found at a warehouse along Konet Danja. But the question here is, the world is now battling with the invisible enemy, COVID-19. People are needing food, especially during this period of Ramadan. Why are people hoarding this kind of food items?
Some people take advantage of this, unfortunate situation and engage in certain activities that make it so difficult for just an ordinary common man to survive. We have to go to court, we have to, prosecute the case because it's a crime, and certainly we are optimistic of conviction. After conviction, then this property will go to the masses.
He also warned traders to desist from this ungodly act, saying the process is a continuous one until sanity is maintained. In Kanu, Yohannes Hassanbaro, NTA News.
Now to Benue, where Governor Samuel Otom has charged security agencies in the state to arrest with immediate effect persons suspected to perpetrate crises in various communities of the state. The governor gave the order shortly after the state expanded Security Council meeting in Makurdi. Charles Abba reports that the council also suspended 3 traditional leaders for allegedly abating crisis in their domains.
Issues of communal clashes in Makurdi, Ushongo, Gwewes and other areas of Benue State dominated deliberations at the State Expanded Security Council meeting. Governor Samuel Otom, who reminded herdsmen that the open grazing prohibition and ranches establishment law is still in force, lamented the spate of communal clashes and other disturbances being perpetrated even in the face of COVID-19. He announced the suspension of a kindred head and 2 district heads, Chief Peter Ikyum of Isho and Chief Age Kuhe of Mbasumbo, alleged to be brains behind some of the land disputes that have displaced many people.
Where there are crises, the first thing to do is to find amicable dialogue and discussion and resolution. It is not to take arms against yourself.
He explained that the Security Council has set up a panel to investigate the immediate and remote causes of the impasse and asked the Tortiv to set up a committee to probe the gravity of the allegations leveled against the suspended chiefs. As a solution to the present economic downturn occasioned by COVID-19, the governor reiterated that agriculture is the last resort. In Makurdi, Charles Abba, NTA News.
The remains of one of Nigeria's music icons and high life mastery, Sir Dr. Victor Olaiya, have been laid to rest. The burial was private and was conducted at the Ikoyi Vaults and Gardens with just a sizable number of family members and clerics, in line with the COVID-19 burial guides by the federal and Lagos state governments. And that's Nationwide today. We thank you for being part of it. Do remember that staying safe is now a national priority. Good evening.
I am elite.